You've probably heard of Bitcoin or cryptocurrency, but did you know the same technology behind it could change healthcare? From medical records to payments, blockchain and crypto could shake things up. So in this series, we're going to break it down together. No tech jargon, just simple explanations with real-world examples. Sound good? Let's get started. All right, first things first, what even is cryptocurrency? Think of it like digital cash. You can send it to someone online just like sending an email, but instead of using a bank or PayPal, it's direct, peer-to-peer. Let's say you want to send money to a friend in another country. With a bank, you might have to pay fees and wait days for the transfer. With crypto, it can happen instantly and often with lower fees. Sounds good, right? But there's more to it than just that. Crypto runs on something called blockchain, which is a fancy way of saying a secure, permanent digital record. Think of it like a shared medical record that every doctor and hospital can see, but no one can erase or change. Every time new information is added, the old records stay visible too. That means no missing charts, no lost patient history, everything is traceable and trustworthy. Blockchain does the same thing for money. It records every transaction so that no one can fake, erase, or double spend their funds. That's why people say it's decentralized. No single company or government controls it. So why does crypto even exist? The whole idea is to make money transactions faster, cheaper, and more transparent by removing middlemen. Claims go through multiple companies, approvals, and delays. Now imagine if medical payments were instant. No waiting, no paperwork, no surprise fees. Some people believe blockchain could help with that. Transactions are verified by thousands of computers. Okay, but is it actually safe? That's where things get tricky. The good. It's hard to fake or hack. Unlike credit cards, no one can duplicate a Bitcoin. There's no middleman controlling it. Banks can freeze accounts, but crypto is controlled by the people using it, not a company. The risks. Some projects promise big returns and disappear. Think Ponzi schemes. Lost money is gone forever. If you forget your password, aka private key, you can't reset it like a normal account. Not all coins are legit. Some are made just to trick people into investing. Just like in healthcare, not all miracle cures are real. You have to research before trusting new treatments. Crypto is the same way. Some projects are groundbreaking, others are scams. The moral of the story? If something sounds too good to be true, it probably is. In our next episodes, we'll cover how blockchain can fix medical records, could crypto replace insurance companies, the future of medical payments without banks. If you were as curious as I am, let's figure this out together. Hit subscribe, and I'll see you in the next episode.